Hello, my name is Wayne Chu, and this is an analysis and improvement alternatives of healthcare access in the state of New York. We'll be taking a multi-spectrum view of these implementation projects, and we'll be looking at them through three different major criteria: the political, financial, and the patient criteria. This is important because there needs to be a favorable political drive as well as a positive financial incentive for these projects to be implemented. More importantly, we need to figure out from the patient's experience to see whether or not these projects actually help them to get the care that they need. The first of the projects that we're looking at is a study done in Canada by Cameron et al. Using open access scheduling. This is good in a political and financial point of view, primarily because it gives the doctors and providers a great deal of autonomy, and it is cost neutral. The patients themselves actually have improvement because their wait times to get in to see the doctor is decreased. The second study that we're looking at was patient navigator programs and use of care coordinators for patients after discharge to be evaluated and followed up by their primary care doctors. This is important because it is a direct improvement of the quality measures that are measured by the CMS. From a cost point of view, it is neutral because patient navigators can be quite expensive. However, from a patient's point of view, they have increased access after discharge, and this has decreased their readmission rates, which is good for patients. The third study that was looked at was the return of service program, which required the provincial government, as this was a study done in Canada again, to contract with medical care providers that they will finance their medical education, and after they finish, they will be sent and contracted to work in rural areas. This is a politically good move, primarily because it is a direct increase in providers to rural areas. However, from a financial point of view, this can be negative to neutral, primarily because medical training can be quite expensive. And for the patients themselves in these rural areas, this is good, primarily because they have been given an increase in the amount of providers that they can have access to. Lastly, we look at doing nothing, which in the current political climate may be good because there has been increased contention in the spending of money on medical treatments. From a financial criterion, it may be neutral to good because medical care is costly. But for the patients themselves, they're already having a lack of access to care. So this will continue to be bad for them if we do nothing. The above has been an evaluation of the different and alternative projects to improve healthcare access. Thank you.